In this video, I'm going to share with you how to work on quality knee extension, especially terminal knee extension, in a more comfortable approach than traditional methods. So a lot of times when people are lacking terminal knee extension, people are doing a lot of pushing on the joint mobilizations, just a ton of quad exercises, shorter quads, quad squeezes, single leg raises, etc. And they're not often so helpful. So using bone rhythms, the experience into knee extension can be a lot more comfortable for people. You can use these bone rhythms in this simple drill here immediately post-op, or you can use them throughout the training just to facilitate better control around the knee joint, which is going to mean better connection to the foot, better connection into the hips and core. So I'll pull up my pants so you can actually see the knee a little bit better. It's nice to have something to slide so you can go into extension a little bit better. If you're doing it on the floor like I am, it's helpful to have a bolster underneath your hips. First, is always nice to check your extension. My left knee tends to be my more prone knee, so just see what my quad extension is like, which is not actually terrible today. I do get my heel off the ground quite a bit, so it'll be interesting to see if this changes it. So the bone rhythms around the knee is when we flex, the tibia fibula complex internally rotates, and then the femur externally rotates. And then when we extend, it switches. The touching of the skin is really important because it helps to improve the body awareness, the awareness around the knee, and helps to facilitate the natural rhythms of the bone that is happening on the inside. So these are arthrokinematic motions that are happening within the joint. You can put your hands on the client. I like that. It's a really cool experience for the client. But even if you're doing this on your own body, you can use your own hands. And it's just a nice, gentle slide. So as I come up into flexion, internal rotation, lower leg, external rotation, upper leg. And then as I come down, it's reverse. So if I'm working on terminal knee extension, I'm just going to do the last little, 25 degrees or so. And I might even, when I'm doing this with a client, say the words out loud. So I'll say tibia external, femur internal. Tibia external, femur internal. And I might have them repeat. It might be as simple as low leg out, upper leg in. Low out, upper in. Low out, upper in. Low out, upper in. And then you can recheck. So in what you notice, even on me, who I had pretty good extension to begin with, a much stronger quad and more extension, more heel off the ground. Really simple. Like I said, you can do it in this position on the table. You can do it on a leg shuttle or reformer, like leg press type thing. You can do it in a standing squat. You can do it in a single leg position, any position you want. Just practice understanding the bone rhythms, teaching your client the bone rhythms, and have them embody them through touch, through movement, through voice, and see what changes you can make.